You know, every week in this place we find dogs that have got skin conditions, skin problems. But it gets very expensive, and this is a struggling shelter. So we're running a little project here where we are treating the dogs rather differently, those dogs that have got skin conditions. And we're going to go into this kennel now. Oh, just trod on a puppy. We're going to go into this kennel now and have a chat with Teresa to find out what's going on and why.
Allergy dogs, the first thing we do is give them a diet that they have never eaten before, and that's fish. That's why we have only fish the first 2 weeks.
And this is for all the dogs with skin conditions?
So all the dogs with skin condition are here except for Tale. He's in the other side.
Okay.
And they get that just so that we are doing an elimination diet, elimination procedure, because we cannot do all the tests on the dogs. It's too expensive. So we have to do it like elimination. So we give all of them fish to be sure that it's not the full diet. Now, this week, after 2 weeks, we add squash, a vegetable. And we see there is no changes, so that means that it's okay. You know what I mean? We will keep on increasing until we see if any of the dog, and we do an evaluation on each of the dog every week to see if they scratch, to see if they get more redness, to see if they get more, rashes all over the body. In that way, we can evaluate if it is the food. That was the first 2 weeks, and then the second week we have added medicine. The vet with the picture diagnostic and with the evaluation we have given her, she do an evaluation and she give medicine. So we have started with medicine on the second week, and some of the dogs are in medicine, some are not in medicine, just with the cream and the ear liniment, and then we see the results. So we are doing this evaluation every week to see, and I see already a changes. I don't see anybody scratching. Before they were scratching all over.
So great results so far.
So far great. After, I think we're going to do it an 8-week test, and after that we will start with giving them ordinary food and see if there is a change. Then we know which are food allergy. We will take off the medicine and see if we take away the medicine if they get allergy again. So that is what we meant by elimination process. Every day, every week, some dog 3 times a week, some dog 1 time a week, and some dog once every 2 weeks. They are very with Malecep. It's a special shampoo. It costs 1,700, and we use 2,000 milliliters per week. So yesterday I was like telling them I cannot have that too expensive. So I'm going to use that on the worst dogs. And then I bought another shampoo to try that is cheaper, but also for allergy. So we will try that out.
So it's food and grooming that's key. Yeah. Okay.
And then after that after they have shower, all of them will get this coconut oil with turmeric. That is herb like, because it prevents the ticks from coming, and at the same time it helps the skin, because turmeric is anti-inflammatory, and the coconut helps the skin, so will not be so dry.
So all under control conditions. These dogs don't mix with any other dogs.
No.
They're control conditions. And how long does this trial or experiment, if you like, last for?
8 weeks to begin with, and then maybe some will have to extend.
Okay. Would be really interesting to see what the results are at the end of it.
I already see the results. They were scratching all the time before. You see, none of them are scratching. I've been here almost 45 minutes now, and I don't see anyone except one dog was scratching the ears.
So I think it's going to be very interesting to see what the results of this skincare project are going to be like. And going forwards, if it works, then it's going to be cheaper for this shelter, and probably better for the dogs as well. So keep an eye out. Keep an eye out for dogs fighting. Keep an eye out for the updates on the project, and subscribe to this channel to make sure that you don't miss what's coming up next.